join you this evening. I wanted to discuss the topic of stroke with you. In Louisiana, stroke is the fourth largest cause of death among citizens, and it is the first or the leading cause of disability. There are many things that we can do for ourselves to stop strokes from occurring. One of the biggest risk factors is high blood pressure. And what happens with high blood pressure is the consistent pressure on the arteries causes damage, so the arteries can burst and they can clog up more easily, causing bleeding in the brain. Another risk factor is heart disease. With most heart diseases, the heart's not beating properly, and blood can pool in the heart, and anytime blood stays stagnant, it can form a clot, and then when the heart is beating, it can push that clot up into your brain and cause a stroke. Another major risk factor is diabetes. People with diabetes are 2 to 4 times at a greater risk to have a stroke than an individual who does not have diabetes. What happens with diabetes is the fatty deposits will adhere to the arteries and can cause the blood vessels to clog up in those little fatty deposits, and then they can break loose and also go to the brain. And of course, we know cigarette smoking is a big factor with stroke. What that does is it also damages the blood vessels, and it also increases the blood pressure, which in turn can cause you to have a stroke. Most of these, not all of these, we can correct ourselves. The high blood pressure, if we take our medications like we're supposed to, if we monitor our weight, it puts less stress on the heart. The diabetes, again, take our medications like we're supposed to, watch our weight, and of course cigarette smoking. If you don't smoke, don't start smoking. If you do smoke, try to find a way to stop. Let's see. I want to make sure that everyone knows the symptoms or recognizes if someone has a stroke, is having a stroke. If you feel numbness or tingling in your hands or on your face, if you start to have some visual changes, you can't see as clear as you used to, if all of a sudden you are confused and you have trouble speaking, if you feel dizzy or you have trouble walking, or you have a headache all of a sudden, like one of the worst headaches you've ever had, and you don't know what it's caused from. These are all possible symptoms of stroke. And the best thing to do, if you experience any of these symptoms, is immediately call 911. The sooner you get to the hospital, the sooner you can get treated with what they call clot busters. And just remember that time saved is brain saved. The sooner you can get to the hospital and get oxygen back to that brain, the lower of a chance you will have of having permanent damage. Any questions? Well, thank you so much for joining me. I really appreciate it. Yay.